Okay, so next question. I think in the exam paper, I forgot to write the full statement, or maybe I wrote, but it was not there, because here also it is not there. So I wrote that which stage of natural history of disease involves the initial interaction between the host and the agent. Okay, na? So in this case, they are asking us about the initial interaction between host and in the agent, that will be pre-pathogenesis. So pre-pathogenesis means initial interaction between host agent environment before the onset of disease. Okay na? So what are the characteristic for this? These will be presence of risk factor, potential for development but no clinical sign and symptoms. Okay na? So potential for development of disease but no clinical sign and symptoms. Okay na? What is the significance of pre-pathogenesis? Significance will be risk identification, and you can do health promotion and education. Means it is the stage you can do primordial, you can do primary prevention. Means risk factor is present, so you can use primary prevention. What is pathogenesis? Pathogenesis means stage where disease process begins following the initial interaction, that will be the pathogenesis. Clinical stage means manifestation of signs and symptoms. Recovery stage means where disease will resolve and patient will return to the normal health. Okay na? So since this question was incomplete in exam, so maybe we will give everyone 1 plus point. Okay na? So those who got it correct, they already got. Those who got incorrect, we will put them 1 plus point extra. Okay. Next question is, which of the following describe the time aspect in the descriptive epidemiology? Okay na? So first we will read all the option, then we will come on to the answer. So first, the geographical distribution of disease. If it is written as geographical, geographical means it is related to the place. Okay na? Second is demographic characteristic of the affected individual, means it is related to the person. Okay na? Third one is seasonal variation of disease occurrence. Okay na? So this is time, because in particular time it is coming. Then last is socio-economic status of the population. This is also related to the person. Okay na? So in descriptive epidemiology we have three: place, person and time. Place means in which geographical area or this place he is living. Demographic or socio-economic will define as the person, and seasonal will be the time. So since they are asking the time aspect, so correct answer will be seasonal variation. Okay na? Next is seasonal variation means like specific time of year some type of disorders are more common. Like if you know, common cold, influenza, all those are more common in winter. Malaria is more common in rainy season. So they have particular time of the year what time they are appearing more commonly. In this time one, we have secular trend, we have seasonal trends, we have cyclic trend, and we have short term fluctuation. Okay na? So in time descriptive epidemiology, we have secular trend, we have seasonal trend, okay, we have cyclical trend or cyclic trend, and we have short term fluctuations. Okay na? Secular trend means they observed over years. Okay na? So they are long term. For example, obesity. Okay na? Seasonal means particular season, like in winter influenza, in rainy season malaria. Cyclical means regular fluctuation over a period, like some infectious disease. Short term fluctuations means sudden increase in disease cases like epidemic, all those will be the short term fluctuation. So since they are asking in the time perspective, the answer will be seasonal variation. Next is which of the following best describe main advantage of nested case control study within a cohort study. Okay na? So before knowing going into detail of the question, we need to know what is nested case control study. Okay na. So nested case control study, it is a type of case control. Okay na. It is a type of case control study conducted within defined cohort. Okay na. So it is conducted within a defined cohort. Okay na. So in these cases, the cases are particular cases of particular outcome are identified within the cohort, and then we will take the controls, or you can say controls are selected from the same cohort for the comparison. Okay na. So we will take the disease or the outcome of cohort, and we will also take the controls from the same cohort for the comparison basis. Okay na. That is called nested case control study. What are the advantages? Since it is a prospective study, okay na, so we will have less recall bias. Okay na. Second one, it is cost effective. Okay. Third one, it has temporal relation. Okay na, it has temporal relationships. Okay na. So temporal relationship between exposure and the outcome, because it is a prospective study, so patient need not to remind so many things, and we can like check all the outcomes. Okay. What will be the disadvantage of this study? First one is we will have limited data. Okay na, we can take data only from the cohort, so limited cohort data. Second one, selection of the control. Okay na, because we need to select control from the cohort only, so then the selection of the control will also be the disadvantage. But in which cases you will use this, or where it will apply? So you can use this for the biomarker research. Okay na, so you will take blood sample, you will do, or some rare outcome in cohort, you can use this study. Okay na. So now coming on to the option. So first one is, it allows direct calculation of incidence rates. No. It reduces recall bias by using pre-collected exposure data. Maybe. Next is, eliminates need for a control group. No, because we are taking control from the cohort. It provides cross-sectional snapshot of exposure and outcome. This is also incorrect. Okay na. So the correct answer will be B. Okay na, because it will decreases the recall bias, because it is a prospective study. So nested case control study are the studies or case control studies conducted within the cohort. Okay na, conducted within the defined cohort. Okay na. If you want to know about this incidence rate detail, this one we will do into the cohort study. So this is a feature of cohort study which mainly focus on to the odds ratio and all those things, but here the answer will be reduced recall bias. Next question is, in a population of 10,000, 200 new cases were there in a year. You need to check the incidence rate per 1,000 population. So what is incidence? Incidence rate means rate at which new cases of disease. Okay na. So incidence means rate at which new cases occur in a population over a specific period. So what will be the formula? Incidence rate is equal to number of new cases divided by population at risk. Okay na, and multiplied by the 1,000. So how many new cases? 200 divided by population at risk, total 10,000 population. And what in which population we want to check, in or which multiplier we will use? 1,000. So if you will check, the answer will be 20 per 1,000. Okay na. So answer will be 20 per 1,000. So this is the answer for this question. Okay na. Or there is a easy way. We have 10,000 population or people, 200 cases. So if I will want to use, or I want to take it for 1,000 people, I can remove 1 0 and it will be 20. Same if it is for 100, then the answer will be how much? Then the answer will be 2. Okay na? So you can also use this calculation to get the answer. So here correct answer will be 20 per 1000 population. Next is, which type of vaccine is specifically designed to protect against the bacterial toxin? Okay na? So we have several types of vaccine. Live attenuated, okay, we have toxoid, we have subunit vaccine, we have conjugate vaccine, and we have inactivated vaccines. Okay na? So what is live attenuated? In this one we are using the weakened forms of organism or pathogen. In toxoid we are using the, or these are designed to protect against the bacterial toxin. They contain inactivated toxins. Okay na? So what happened? Inactivated toxins, or these are also called as toxoids. So whenever we will give these vaccine to someone, they will stimulate the immune response without causing any disease. So these are toxoid vaccine. Subunit means some specific part of pathogen is present in these vaccine. Okay na? Conjugate means they use polysaccharide linked to proteins. Those parts are used in conjugated vaccines. And in inactivated we are using the killed pathogen. Okay na? So they are asking us about the which of the vaccine is specifically designed to protect against the bacterial toxin. Then the answer will be toxoid vaccine, because it is having inactivated form of toxin. That's why it will mimic as the like it will provide us the immunity but without causing any disease. Okay, so answer will be toxoid. Next is, at what age first dose of diphtheria, tetanus and pertussis DTaP vaccine typically administered according to the standard immunization schedule? Okay na? So surely this is not given at the birth. Okay na? And then they are asking the first dose. So it will not be 6 months, not the 12 months. So first will be 2 months. So if you want to remember what time we are giving DTaP dose, we are giving at 2 month, 4 month, 6 month. Okay, then after 6 month we will be giving 15 to 80 month, and then 4 to 6 years. Okay na? So this is the full immunization schedule for the DTaP. At birth, what vaccines you are giving? Immediately after birth you will give BCG, vitamin K, and you will within the 24 hours of birth you will give hepatitis B. Okay, so these are the vaccines you will give at birth. And DTaP you will give first dose as 2, second as 4, then 6, then you will give booster dose as 15 to 18 month and 4 to 6 years. Okay, so this is about DTaP. Next question is, what are the primary goal of screening test or screening program? Okay na? So what are the primary goals of screening program? First goal is early detection. Okay na? Early detection means we will identify all the high risk group and we will facilitate early intervention. Second one is reduces morbidity and mortality. Okay na? If we got to know that these are the high risk people, we can decrease their morbidity and mortality by improving their health outcomes. Third one, we can promote, or the main aim is promote health awareness. And fourth one is help in further diagnostic testing. Okay na? So these are the primary goals of screening program. So now what is the first option? To diagnose the disease? No. To reduce the healthcare cost? No. To identify the individuals with the high risk? Yes. And to replace the diagnostic test? No. So the correct answer will be, the main aim is to identify the people who are at the high risk, so that is early detection. Next is, which of the following best describe the concept of validity in the screening test? Okay na? So first we will read one by one these definition and what they mean we will write, then we will come on to the answer. So first option is saying ability of the test to produce consistent result over time. If you know, this is called reliability. So this is not the answer. Second one is saying ability of the test to correctly identify those with the disease and without the disease. Yes, this is called as, so this is called as validity. Okay na? So with the disease means it is sensitive, or this is called sensitivity, and without the disease means specificity. So validity is dependent, or it has two components, sensitivity and specificity. Sensitivity will be determined the true positive, and specificity will be determined by the true negative. Okay, so the correct answer will be B. Okay, next is written probability that a person with a positive test result actually has the disease. So this is called as positive predictive value. Means who is positive for the test, actually they are having the disease, that is positive predictive value. Next is proportion of the true negative among all negative test. Okay, test results means they are saying these are the true negative out of all. So this will be our negative predictive value. Okay na, means those who are negative for the test, they are also not having any disease, that is negative predictive value. So this is, here they are asking about the validity, so correct answer will be B. Okay, so validity has two components, sensitivity and specificity, which will tell us about the true positive and true negative. True positive means how much sensitivity, and true negative means how much specificity. Next question is about the what is the best way to plot changes in incidence of disease in a given area of time? Okay, na, so we need to understand the graph. So here I am having all these four graphs pictures. So first one you can see, this is the diagram, this is called as histogram. Okay na, so histogram is used for the frequency distribution of continuous variable data. Okay na, continuous variable data. If you will see height, the height will determine the frequency of data. Okay, so height of the bar is determine the frequency of data within this bin, and distribution of a single variable at any specific point of time. This will also show by the histogram. Okay, what are the advantage? It will show distribution and spread of data, plus highlighting the central tendencies and variability. So histogram will also show us the central tendencies and variability. Okay, next diagram is called as, ogive graph, Ogiv's graph, or this is also known as cumulative frequency curve. Okay, the purpose is to display cumulative frequency distribution into the x-axis. In the x-axis we have data values, in the y-axis, into the x-axis we have data values, in the y-axis we are having cumulative frequencies, and this will show us data into the percentile and quartile. Okay na, and if you will see in this we don't have any dips. Okay na, so this graph will not show any dips into their dips, or like up or low movement like in here, they will not show in the ogives. So this is ogive. Next is line graph. Okay na, so line graph, you can see the purpose of line graph is to display data over time. Okay na. So time series data will be showed by the line graph. Into the x-axis we have time interval, into the y-axis we will have variable of interest like incidence or anything, and it will show us trends, it will show us patterns, and it will also show us fluctuations. So you will see these drops and upward movement. This is specific for line graph. Here this is the tree diagram. Okay na. So this is called tree diagram. Okay na. This is the purpose of this to illustrate hierarchical relationship and decision process. Okay na. So the node will show us the decision or category. Okay, and the branches, all these branches will show us subcategory or the outcome. Okay na. So what is the question asking? Incidence of disease in a over given area over time. So correct answer will be line, because it will show us trends, and it is the display of, it will show us the display of data over the time. So next question is, in an area with endemic vitamin A deficiency, what is the prophylactic dose of vitamin A in 1 to 6 year old boy? Okay na. So generally we will give vitamin A prophylactic dose in 1 to 6 year child. The amount will be 1 lakh per 6th month, per 6 month. Okay na. But if he is from area where they have endemic vitamin A deficiency, okay na, then in case we will increase the dose to the 6 lakh per 6 months. So correct answer will be the 2 lakhs in 6 months. Okay na, 2 lakhs in 6 months. Next is, while doing the experiment, 59 was the highest number, but it was mistaken for 95. What affect the calculation? So suppose I have some data, okay, random, okay, and I have this 6, 10, 50, 59, all those, okay, and then you have taken this 59 as 95. So if any number which is way higher than the usual, okay na, then this is called outlier. And whenever we have any outlier in our calculation, it will affect the mean. Okay na. So mean will be affected, but our median will not show any changes. Why? Because we will arrange them into the sequence, and whatever will be the center number, that will be our median. So it will increases the mean, and there will be no change in the median, even no change will be with the mode. Okay na, because mode will be what number is coming more frequently. So both will be unchanged, only mean will be increased. Next is 40-year-old male having a pet dog in his house. He presented to hospital with pain in the right upper abdomen. On evaluation, there is a loculated collection found in the liver. Which of the following organism is implicated? So if you know, in the liver, loculated cyst means it is our hydrated cyst. Okay na. And hydrated cyst is caused by Echinococcus granulosus. Since they have given the history of dog also, because it is transmitted by the dog, so it is Echinococcus granulosus. Why not Taenia solium? Because it is transmitted by the pig. Fasciola hepatica, this is called as Fasciola hepatica, which is a liver fluid. Okay na. So it will not cause hydrated cyst. And Amoeba coli mainly affect the intestine. Okay na. And it will not have loculated cyst. That's why it is not the answer. So since we have history dog, like dog, he is having dog, plus he is having pain in right upper abdomen, plus loculated collection, classical for Echinococcus granulosus. Next question is about National Health Program, which is not included in JSY, Janni Suraksha Yojana scheme. Okay na. So why this one we have got in 2005. Okay na. What is the main purpose? Is to increase the institutional deliveries. Okay na. Why we want to increase the institutional deliveries? To provide proper care to the mother and child. So to decrease the maternal mortality rate. Okay. So first answer is true option for this. Second, Bande Matram scheme is a public private service. Okay na, and this is also related to this scheme, so that's why this is also the correct. And since I want to decrease the maternal mortality, that's why I can really they can also consult about the STD, but it will never give the service of abortion. So this will not come in the generally Janni Suraksha Yojana scheme. It will come under the family planning programs. Okay, so the correct answer is abortion. Next is, if a correlation between the weight and height is very strong, what will be the correlation coefficient? So here you can see we have correlation coefficient positive, negative and no correlation. It generally vary between from 1 to 0 to +1. Whenever we have -1, negative correlation, means it is not like it is protective for that disease. Okay na, it is like protective for the disease, or I can say okay na. So next question is about, if correlation between the weight and height is very strong, what will be the correlation coefficient? Okay na, so if they are related, so correlation coefficient is vary between -1 to 0 to +1. If it is strongly related, it will be positive. If it is not strongly or weakly related, it will be negative. And if no relation, means it will be 0. So positive correlation or strong correlation will be +1. Negative or weak correlation will be -1, and no correlation will be 0. So here correct answer will be +1. Okay, so the correct answer will be +1. Next is, in a population of 2 lakh, there are 4,000 live birth reported. Causes of maternal death were as follows: 2 deaths because of ectopic pregnancy, 2 deaths because of puerperal sepsis, 2 deaths because of abortion, 4 deaths because of postpartum hemorrhage. There were also 2 deaths because of electrocution and 5 stillbirth. What is the MMR, maternal mortality ratio? So you need to know the formula for maternal mortality ratio. It is the total maternal death because of pregnancy. So it can be because of so many causes. So it can be because it can be prenatal, or it can be during the delivery, or it can be 42 days after the delivery. If any death occur in these females, that will consider as maternal death. Plus it is divided by total live births and it is multiplied by 1 lakh. Okay na, so this is the formula. So how many total death? 1 means 2, 2 4, 2 6 and 4 10. Okay na, why we will not include these two? Because this death is not because of maternal complication, and stillbirth we will not count. So total 10 maternal death divided by 4,000 live birth, and you will multiply this with 1 lakh. Okay na. So now how much will be the answer? Will be 250. So correct answer will be 250 in 1 lakh population. So this is the correct answer for the question. So next is Sullivan index. So if you know Sullivan index means the life free of any disability. Okay na, so expectation of life free of disability will called as Sullivan index. So how you will calculate this? You will calculate this by formula life expectancy minus years of or years with disability. Okay na, when you will do minus whatever the total come, that is our Sullivan index. Okay, so this is the answer for this one. And in the last, this question was repeated. Okay na, so this is the thyroglossal cyst. Okay na, infected thyroglossal cyst. So first will be the incision and drainage, and then we will do cyst trunk operation. So this is the end of the discussion. Thank you very much. And if you have any doubt, please do comment. We will reach out to you. And if you like the this discussion, please like, share, and subscribe. Thank you.